one of the ones that I was really interested in was there is a session out of Memorial Sloan Kettering that talks about hereditary cancer syndromes and the MSK Catch program that they have up there. And I think that's important to oncology nurses because we don't really know. We know that there are genetic mutations. We know that they impact how patients are treated, but this is really following the patient even before they develop a cancer. And I think it's important for us to understand where these patients have come from, and also how that can be implemented at our own centers. And maybe not even that weren't even aware that that stuff is happening at their own center. So I think that's an important session to highlight this whole area of collaborative care that we may not even be aware is really occurring. We also have a session on remembrance and renewal, and it's really a self-care session, and this comes out of Ohio State, and it's a program that they've already implemented. And it's very interesting because, we as caregivers and nurses can't really care for our patients well if we don't care for ourselves. So I think it's important that nurses kind of get an overview of a strategy that's working at an institution so that they can take it home with them to maybe implement a few of those things. Because I think post-pandemic, nurses in general are worn out. I think oncology nurses live a little bit worn out because it is such an all-encompassing job to take care of cancer patients. You know them for sometimes a very long time, their family, their story. And so I think we need to remember that we have to take care of ourselves as well as taking care of our patients. We have, that session on remembrance and renewal. And I think that there are a couple good strategies within that session. I've seen, the preview of the slides initially when we were developing the content. And I think there are some nice things that they can take away to bring back to their institution where, there are just one of the tactics is to have kind of a little ceremony after a patient has passed. I think we're so used to as nurses, you hear a patient has passed, you move on to the next patient that needs you to take care of them. So I think there's a nice tactic there to like pause and kind of reflect and remember that patient and what they meant to you. I think we also have a session that I didn't mention, but we have an ambulatory care model session. And I think that, without being able to have a full picture of how this patient goes across the continuum of care and kind of looking at it as piece by piece instead of a flowing river, I think that, the patient loses quality care sometimes. So this ambulatory care model session is really going to focus on how you can follow the patient through all of the phases of their treatment, and you can do that seamlessly. So I think that if you have a choppy kind of framework at your institution, this might help you kind of streamline that. And I think too, there are pharmacological changes that impact everybody in melanoma. Ultimately, there's been a shift to do neoadjuvant care instead of just managing a patient when they're metastatic. So there's some new tactics for managing those patients and, the new advancements in treatment. So I think those are takeaways that people can take back with them. It's no longer just the doctor and the nurse taking care of the patient. Years ago, when I first started, that was the case, but now it's a whole group of people. You have lay navigators, you have nurse navigators, you have pharmacists, clinical pharmacists. Everybody has a part in the care of the patient. So I think understanding that continuum of care is really important, and highlighting how it's evolved is super important. I think patient advocacy, mental health, financial toxicity, those are all things that are facing patients that we have not had the time or energy to really focus on when it was just the doctor and the nurse. But now everybody's so involved in it that each of us can maybe take a little bit and chip away at that problem and help the patient have a better experience. it's tough when your patient's faced with the ability to choose, or the challenge of choosing, do I pay for my groceries or do I pay for this drug? Where there may be support in, financial assistance programs or drug reimbursement programs that helps them get that without them having to make that choice. And I think it's knowing where those things occur and how across that continuum of care that communication can happen. There is a need for navigators. There are a need for, the pharmacy support and the clinical pharmacists, that nurse practitioners have a larger role, that APPs, like PAs, have a role in this. So I think, we have to open our minds to that nursing and care of a patient isn't happening just the way it always happened. So we have to focus on things that are maybe just not as specific to the bedside nurse and maybe more specific to those people who are, on the phone trying to get that drug coverage, or in the background, making sure that that patient has what they need at home just to live their life, the services they need, the support they need, home care. So we have to shift our focus from just those people who give chemotherapy every day and who maybe see the patient in person more often, to the people that are surrounding the patient, who make up that whole continuum of care and that whole care team. And so we want to just have a wide variety of options so that we can draw in all of those types of nurses and support folks.